everyone, my name is Dr. Indra. Today we're going to be talking all about thyroid. We are seeing a lot of patients with interesting symptoms, and today we have with us Dr. Patel, Natasha, who is our resident endocrinologist and functional medicine doctor. Hi, Tash.
Hi, Indy.
So today we're having a really open conversation, aren't we, today? Just to kind of get to thyroid disease, what it's all about, and the kind of questions we often get asked about. Isn't that right?
Yes,
Definitely. So, first of all, I know I've introduced you as our resident endocrinologist. Tell us a little bit more about you and why thyroid has become a major part of what you do.
of course. So I'm a consultant in diabetes and endocrinology, as well as acute and general medicine. And I've been working in the world of diabetes and endocrinology actually since 2002. And over this time, one of the most commonest conditions you see, other than people with diabetes, is individuals with thyroid. And on the NHS side of things, we're limited to how we can support individuals, which is why I have become so interested in taking the whole body approach to managing an individual who is experiencing an underactive thyroid gland. So yes, the kind of things I was noticing was that people were complaining of brain fog, fatigue, tiredness, lethargy, achy, weren't able to perform at a level that they wanted to, and yet they were taking their thyroxine. It felt when they were talking that they felt that their symptoms were being dismissed, which is why I went down this route to see how could I support this cohort of individuals through this approach that you and I have discovered over the years.
It's interesting, isn't it? This kind of whole person approach. Thinking about patients that might be, or people that might be viewing this video, what, why do you think it's become so common nowadays? Or maybe actually, even before we start, you've mentioned some of the symptoms that people may be struggling with. Would you say they're the key ones? What would you say are the key ones? And then tell us a little bit more why you think it's become or seems to have become really common.
So, I can't say which are the most commonest, I have to say, in this cohort of people, because people don't come up enough or come forward enough to say that they're experiencing. We're living in a time often where people have accepted this as their norm,
Yeah.
not realizing that there is another possibility, that we don't have to accept it, that we don't have to settle for feeling second best.
Yes.
And also with these conditions, it's been a gradual thing that you often don't realize that this has come up on you.
I think they say
Um,
it takes sometimes thyroid illnesses or autoimmune type illnesses start maybe 10 years. You have the antibodies and things even 10
yeah.
years before you actually see some of the symptoms even.
But it's also what I personally believe is, so my own personal is that we live in a society of the moment of chronic stress. And
Yeah.
I know that we always used to talk about stress related to survival, like the classic is a saber-tooth tiger.
Yeah.
But in reality today, it's about you're crossing the road. You need to be on alert to cross the road. You're driving your car, you're trying to get the kids out to school, you're getting up, you're trying to get to work. We're constantly on the go, always. And it's the fact that we're always in this state of chronic stress that I personally believe we often don't pick up the symptoms. We don't hear what our body is telling us until we crash. And then at that stage, that's when somebody will most likely come and see me and say, I'm tired, I'm achy, I can't move, something's not right. But because the symptoms can be connected to so many other conditions, and because in a way they're vague,
Yeah.
It's not like you're having chest pain, somebody, and the type of chest pain I can say to you, you're having a heart attack, let's get this sorted. It can often be a delay in diagnosis and thinking about this is what potentially is the cause of your concerns. What we also, I think, need to remember is that it can be interconnected with other things.
Yeah.
So, for example, being anemic can affect how your thyroid is working. Both conditions can give you similar symptoms.
What else? There's a number of things, isn't it? There's a whole
Oh, so,
dance of hormones that are happening as well, isn't there?
well, there's a lot. We forget what nutritionally our thyroid actually needs in order to work effectively. The most common thing we hear about is iodine. However, the more I learn, the more nuanced I realize iodine is, because for some people, iodine can actually make their thyroid ineffective. And for others, they need that iodine. But things like vitamin D plays an important role, selenium, zinc. These are things, selenium and zinc, that you don't think about routinely or regularly. So unless you're aware, you wouldn't be knowing, are you taking enough? Does your thyroid have enough? This does not mean that I think that everybody should be going out and testing their selenium and zinc. We can look at it nutritionally as to how you're eating, because testing for some of these things can be quite expensive. Knowing your TPO antibodies, understanding whether it is an autoimmune cause that's causing your underactive thyroid. And then what I'm finding fascinating is being able to correlate your level of thyroid antibodies to actually how your gut is working and the interlink between that. And we have seen anecdotally, UI and several other practices I've worked with, that when an individual has been taking thyroxine, they're still not feeling very well, and we've looked at their TPO antibodies, and that's led us to their gut. It has been once we have supported them with their gut that actually they feel better. They've not needed any miraculous treatment for their thyroid, but it needed us to go back a couple of steps. And also, we've seen then the TPO antibodies coming down as well.
So this kind of leads us to this kind of whole person functional medicine approach to supporting somebody with thyroid. What do you feel are the key differences from standard care to a functional medicine approach?
So standard care is about making sure that we've kept you safe. And so the safe thing is to give somebody thyroxine. But we don't, as standard care, go looking to see what's behind that, what's the root of it. So standard care is we've given thyroxine. For majority of patients, that works. There is absolutely nothing wrong with thyroxine. We're giving your body back. However, there is a cohort of people, understandably, that it doesn't work, and that's where we need to go back a little bit. And that's what we won't get on necessarily on standard care. Because standard care in the UK is based on population-based medicine.
Yeah,
And what we're trying to provide is individualized, personalized for you, and just taking the science and information that we know a little bit further.
exactly. So if you were to say, tell us a little bit more about how your consultation is a little bit different from your conventional world versus a functional world, what do you want to know in a functional world that maybe people haven't even thought about relating to their thyroid?
Okay. So I think, first of all, just to deal with a little bit of an elephant in the room is the phrase functional medicine. And I think you and I have had discussions over this, and there are some areas where it has a negative connotation. I think we have to be clear that what you and I mean about functional medicine is that we're looking at the root.
Yeah,
We're trying to understand what's going on. We're not doing voodoo medicine. We're not doing anything that is not ethically correct.
it's all science-based. Everything that we're doing is scientifically to understand how your body is functioning and why is it functioning in the way that it's functioning at this moment in time.
Exactly. And that's our definition. That's what we mean by this. So just because I've seen posts out there in the media, when we're talking about this is that we're looking at the root cause. And so how does my consultation in your practice differ to what I do on the NHS? Well, in the NHS, I've got a limited amount of time, and it will be literally just looking at the symptoms and managing your symptoms. And then the next patient. Um, what I have the opportunity to do whilst I'm working in your practice is to take a longer history, an in-depth history. And actually, I've been a believer, conventional and whole health, this type of medicine, of the history often gives us the answers before I've even ever put a hand on a patient. If you truly listen to somebody's history, you can pick out what the things are. And so a history taking that I would take on in my private practice is longer. It's more intense. It's looking at the connections and trying to bring the dots together. It's not just about looking at the symptoms. It's taking it back a step because of the belief that if we treat and tackle the root causes, then overall we have a better effect rather than just treating the symptoms. And the way I talk about it, analogy, is looking at a crumbling wall. You know, the wall is crumbling because the mortar in between is crumbling. You know, you sometimes have to take that wall back down. You can stick plasterboard on it to keep it going. It'll keep going for a bit longer, but eventually that wall is going to crumble. All you've done is to delay it by a bit longer. And sometimes what you need to do is actually knock the wall down and rebuild it. And that is what we're doing. And the idea is behind at the end of this, you have a blueprint and you have a better understanding as to how your body is working.
I think one of the things that I've seen in a lot of the patients that I've looked after with thyroid is often the triggers that I'm looking for in the history is things like recurrent infections that they may have had when they were early on, because there is now evidence looking at how infections can affect the thyroid, how antibiotics may have affected the gut symptoms. There's often a change associated with maybe with pregnancy. That seems to be a kind of change in where people get their symptoms. Then maybe some medications that might have changed their bodies. So our history goes into looking at what could have been triggering the potential root causes for thyroid. What would you say are your potential root causes for thyroid?
I think those are the things that you have alluded to. I think the most commonest thing I do see is the gut. But the other area that I'm beginning to see is the perimenopause, because the effect that the changes and fluctuations and the hormones have on the thyroid function is also another cohort of people that I'm beginning to see. So those are the main things that I see. If somebody is still not fit, so the other thing that we have to remember about this approach is that we don't always nail it from one appointment
No.
because it's about going and doing things in a logical order. So we will start at the gut, we look at the gut, we support the gut, and then if we see, okay, things are still not quite there, then I will start going and looking for infections. I will also start looking at, well, how effectively is your gut absorbing? Those are the kind of things that as to how I would practice, but also the kind of things that you said, other hormonal changes, stress, sleep. You
Yeah.
know, sleep can have an impact. Stress. I think sometimes people become immune to when we keep talking about stress because we hear about it all the time. But the difference now is that we have got so much more science connecting stress to how our bodies are responding to it physiologically that we've got a lot more now to back us up when we talk about this. And then also it's about when I'm taking a history, we've talked about medication, but also how has your body responded when you first started taking the medication? That's often a bit of a clue as well. Family history, what's gone on in the family. Those are the kind of things that we take, and it takes time. That's why a history taking session for us can take longer than 5-10 minutes.
Absolutely. And I think if anybody's watching this, we've talked a lot about lots and lots of different signs. And if you're not really sure whether these could be related to it, what I'm going to do is to put in a little the MSQ at the bottom of this video, so you'll be able to download it and just do an MSQ of all the symptoms you may be suffering from. Send it back to us and book yourself in a discovery call. Then we'll be able to just talk through some of those symptoms because I think it's very difficult. So a lot of thyroid symptoms can be very subtle, as you mentioned right at the beginning. We've kind of just grown up or grew into these symptoms like, oh, I'm feeling a bit tired, oh, I'm a bit constipated, or my skin is a little bit dry, my hair's a little bit dry, and then suddenly, as you said, crash. And then you're like, oh, I need to go and do something about this. What do you think people can do to support, like if they've got this, and one of the things that people often say to us is that I've had all my bloods checked and everything is normal. Because once we know that these signs are there and people have gone to see their GP, they've done the initial blood test, and often, as you mentioned, I think in the beginning, people often feel very dismissed. So talk us through those blood tests and why people are always saying, everything is normal, doctor.
So, because the blood testing that we would do on the NHS, and I do have another little post coming out on this to explain it in a bit more detail, is that it's looking at your TSH level and your T4. And for everybody out there, TSH is produced by a little gland, just like say behind your nasal bridge, called the pituitary. And it basically goes to your thyroid gland in the neck, and it's responsible for your telling your thyroid how much thyroxine to produce. If your body is not producing enough thyroxine, it produces a lot more TSH because it's telling your thyroid produce more, get going. When your thyroid gland is producing enough thyroxine, your TSH level goes down, also pulled into the normal range. What we have to remember are the ranges on these tests and how long ago that they were identified and determined. And what might be normal for one person may not be normal for somebody else. And then those are the things. I'm not saying though, and I do not want anybody to misunderstand that I would say to you, your thyroid function is normal, you can have thyroxine because you have the symptoms. That is not what I'm saying. You can have a normal function or blood test of your thyroid test, but you may still have some thyroid symptoms because the only tests that we are checking are your TSH and your T4. And although we check your T4, it is your T3. So your T4 is converted to T3. It is your T3 that goes around and is doing the work of your thyroid gland. And for some people, they may not just feel the effects of their T3 for many a reason, or they may not be converting their T4 to their T3. On the NHS side of things, because of how T3 is and how it fluctuates, it's a challenging thing to test all the time, so we don't do it routinely. And there is no need to do it for everybody. The time to check your T3 and possibly our T3 is if you are having really good symptoms and it is suggestive in your history that something's not quite right here. It's worth us just doing this test just to see, are you converting your T4 to T3? And is it a low T3 or your inefficiency to convert T4 to T3 that is causing your symptoms? It may be, though, something else I said earlier, which is it could be something else that's causing these symptoms because these symptoms are vague. But the fact that you're experiencing those symptoms, we have to remember is your body is trying to tell you something. And what we need to do is to unpick it. Having these symptoms does not necessarily mean that you have an underactive thyroid gland, but having your symptoms shouldn't be dismissed.
So this comes to the last point really that we want to talk about is if people are feeling stuck about their thyroid, what are the key things you want them to know about this from our perspective as a practice?
Give me a bit more information there.
For someone who's feeling stuck or discouraged from their
Okay.
thyroid health, and they're just thinking, oh, there must be something wrong with me or whatever. What is it that you really want patients or people that are watching this video to know?
So first of all, this is not a personal failure. The body is adaptive and symptoms are often a sign that it's coping under strain. Healing is possible. I think that is such an important thing, but because we don't hear that on the NHS, is the fact that once we understand how your body is working, we can support you in helping to feel better. But this isn't something that is going to happen overnight. You didn't develop these symptoms overnight. It was a gradual thing. It is going to be a gradual work to get you feeling and doing all the things that you want to do. Frequently, it's a little changes. So I call it the Pareto rule, 80-20. So sometimes it's the small things that changes that you will make that will have an 80% impact. And as over time, then the other saying you often hear me saying is you make 1% difference every day by the end of the year. That's a 365% difference that you have made. So it's a journey. It's not as quick as we like in conventional society. We want instant gratification. Most of us try to watch a TV series in one go. Gone are the days when we were a kid and we would have to patiently wait for the following week or have to wait for the summer period. And I think that is actually part of managing these type of conditions, is that we've got to take this slowly and make sure that we're supporting you listening to your body so that you understand the responses and what's working and what's not working.
That's beautiful. I mean, it has to be taken slowly, and that's why we have our team to support us, because we, as the medics in the team, do the assessment, understand the whole thing, understand what's going on biologically, can give the advice on what kind of nutrition and supplements and lifestyle changes. But it's you that has to make the changes. And that's why we have a team to guide, support, have an accountability partner, whatever you need to take that next step. We're here to support you to do that.
I think just to add to that, is the value of the health coaches. So one of the things I have said throughout this conversation is the impact of chronic stress, and we don't realize that. I don't think we also realize how important a health coach is in supporting us to make those little changes and supporting us as to what are the individual changes we need to make to support ourselves to deal with stress. We can all read about things on Instagram, social media, YouTube, but there's a difference between reading it and seeing what somebody else is doing and working out what is right for you. And that's where I find our health coaches become really helpful, is that they will help you find out what you can implement in your daily life, what is going to work for you that's going to support you. And the other advantage within our team is because we're together, you're not seeing a health coach somewhere else, us here and a nutritionist elsewhere. We're all together, working together, and hopefully trying to sing off the same hymn sheet. We try, we're constantly improving. But that I think is an important thing to let people know about the consultation. So if I say I would recommend a health coach, hopefully this would explain why I'm recommending that.
So, as we draw to a close, we've talked about what thyroid disease is, what the controversies are relating to some of the testing, some of the sort of subtle signs of thyroid, and how, as a whole medicine, whole person, functional medicine approach, we're looking at the whole person. Is there one key thing that you feel that you really want people to know about that maybe we haven't talked about today?
I think the final line I would like to end with is your thyroid symptoms are not a failure. They're information. The symptoms you are experiencing are information. And when we really listen carefully, they can guide us back as to where we want to be.
That's beautiful. So if you're watching this and you feel like this has really resonated with you, and you want to start your journey in exploring how your body's working and really want to understand and get down to the blueprint of you and the amazing you and what your amazing body can do for you, do book in a discovery call in the link in the show notes and let us know if there's any questions you would like us to answer any further. Thank you so much, Natasha, for joining us today, and hopefully we'll do a few more of these as we go along.
Thank you.